I need a doctor to check her. She don't have no appetite. She don't want to eat any food.
This is a little bit like that old show we used to watch as kids. It's like MASH.
There's a macho thing about keeping the testicles of a male dog because it's like, oh, my dog's big and macho, so therefore I am.
Welcome to flight 1434, going to Roatan.
The aggressive ones, though, I feel like he went down really hard.
I gave half a cc. Okay. Just because he twitched when he clamped off.
Okay.
Yeah. His heart rate right now is like 60 to 70. It was 35.
Yeah.
So in a guy like him, he's what? He's about 65 pound, pretty solid, muscular, hardcore dog. What kind of dosing do you recommend for a guy like this? Then the question asked is, why do we use gas anesthesia anymore?
This is our moment. This is our first time down here doing surgery in this manner with just injectable anesthetics. I really don't think we'll have any problems.
Both of our doctors are taller, and so we had just normal folding tables. We had to put weights and cinder blocks, and we had some boxes in the area, and so we just matched things together so that the doctors are comfortable.
This was our first wobbly patient we had, so we just started to use these dumbbells so she doesn't flop over and flop off the table.
For 7 days, yeah, until these run out. Once they're gone, you're done, yeah. So just this week, and just one in the morning, one at night.
You know, my dog needed a little bit of help, you know, because I wasn't here, and then I just came over from the mainland. And when I saw my dog like this, you know, it just hurted me, you know, and I saw the sign, and I said, you know what, I'm gonna go up there.
Lo haces un poco de comida y agua y 3 veces al día con ese.
We do have some awesome people in the village that have volunteered their time to be interpreters for us, so that's really, really helping us as far as the language barrier goes.
So this dog we're going to spay today. However, she was hit by a motorcycle in this rear leg, and she's not walking on it.
We can give it some, anti-inflammatory medication to help with the pain, but we're not going to be able to fix it.
We're surrounded by gym equipment. We've got little kids playing on the gym equipment. Amazing Riyadh. With the sheer number of spectators that are here, I mean, it's like the entire community has shown up for this event. So everybody's here watching, just hanging around at the surgical tables, watching us do surgery.
There's ticks all over him. He's got ticks here. He's got live ones crawling. All these little brown spots.
Been sucking on him for a while.
Well, we kind of had an unfortunate end to the day. We had a dog that just was spayed. Her name is Mississippi, and she belonged to some cute little kids over there. We reversed her drugs, sent her to recovery, where she was doing fine, pulled her catheter, was waking her up, and she stopped breathing. And we noticed right away and brought her back to the table and did everything that we could to bring her back, and it didn't work out. They're not healthy like we see them at home, and so the challenges that we face inside their body, the stuff we don't know about, won the war this time, I guess.
When traveling and doing anesthesia and surgery in a third world country such as Roatan, there are definitely significant risks that come along with working with these animals. They carry numerous diseases. Most of them are anemic, and I think because of some of these factors, we did have a couple of very unfortunate deaths with 2 patients. It was very hard on our team. It was hard on the community, but we did make some adjustments and were able to, rise above that and push through it.
They keep multiplying. The ones that are sick just kind of wander the streets. The owners can't afford food. You know, a lot of this is, you know, in future has got to be education, but for now, we're just trying to get as many to come round to the idea of spaying their dogs. So we've got cultural issues to deal with as well.
Roatan was an undiscovered jewel of the Caribbean. Some people still refer to it as undiscovered, but with all of the tourism happening, and it's not so undiscovered anymore. So before that, the island people in general were like fishermen, simple people, simple way of life. Now, with the boom of the tourism industry and the population exploding so much over the past couple of years, the fishermen are finding it hard to continue living as just fishermen because there's been overfishing, number one, and now there's other industries opening, right? So you have people who snorkel for a living, you have dive masters, you have people who do commercial and sport fishing. So now the local islander who was used to going out 5 in the morning to catch his fish and be back home by lunch, it's not easy for him to continue that way of life.
We got like at least about 45, 50 water taxi. But some of them runs the locals, like some bring the kids down here. We got a big college here in Jonesville. Most of the people work in the processing plant. There when the big boat brings in the shrimp and thing, the ladies and the men work in the processing plant. So that's the main income in Oak Ridge, plus the tourism. That we get little tourism from the west.
See you in a little bit, okay? Yeah. All right.
Like before, it used to be the first commercial thing that you can do over here, fishing, so you can survive off of it. But now, not any longer. It's tourism now. Now that's why I'm preparing myself. Maybe in the future I can open up a day shop and I can hire somebody else, you know, so I can work as well. Somebody from the community, or no, a local guy.
That's a lot better than yesterday. There's a lot less people around, which is nice. The stress level in here is way down. I mean, yesterday I was describing it sort of as like a powder keg, that any kind of wrong move or episode in this whole place was going to explode. There were so many people in here. There were 10 people watching every surgery. The staff was stressed, the people were stressed. I mean, it was crazy.
Big adjustments to our anesthetic protocol today. Our dogs back home are a lot healthier when we worked out our protocol.
We've decided that we're going to intubate some more patients. We're not attaching them to any anesthesia or oxygen, but even just an open airway is very helpful. It's much better.
I think we may have a little bit of like appetite stimulant we could give out just to help her eat a little bit more.
Que si quieres te puedes apuntar de nuevo y que un médico la revise.
Today we're assigning people numbers as they check in, as opposed to just having a mass of people kind of crowd us, which made it really hard with the language barrier.
We've done some crowd control and we've kind of moved all the spectators right out of the surgical field, which has decreased a lot of the chaos.
I think everybody's happy overall as a team, and the sun's shining and people keep coming in, so.
Yeah, day 2, definitely a lot smoother than day 1.
They gave me some flea medicine, you know. I think that the doctor got to see him, you know, he seems okay, so I was the first person out here, so, you know, I'm heading back already. It's well needed on the island because we like, you know, lots of resources over here, and I think this is definitely, you know, a good thing, you know, to the island, you know, for the community to try to keep up the dog population to a minimum, which is well needed over here.
I've only ever done it in a hospital.
This is my first time doing surgery in a garage for sure. It's just a unique setup. Definitely concerned about the temperature today. This thing could turn into an oven.
They brought us some lights today. I'm surprised to see those and excited to see those, so their headlamps won't be the only light for surgery.
Yeah, the dog freaks out as soon as you put it on, rips it off, bites, bit the owner already. So, just dog's scared. Seems to be a lot of dogs here right off the bat.
So we've been dealing a little bit with some aggressive dogs as well. So it's a slightly more challenging situation today.
It's an 8.5-pound dog for the dorm tour.
Yeah.
Because it'd be like
do like 0.11.
0.11,
Yeah.
okay.
Right.
Okay, Wilson, what's your next dog?
Que lo saca él a dar una vuelta, se cae. Y se cae.
But around like 7 o'clock at night, start to can't walk or.
It's drastically warmer in here than it is outside at this moment.
Prior to the surgery and still even during the surgery, I'm not quite right. So I pounded the fluids, I soaked myself in ice cold water, and went in on the surgery.
This dog was most likely attacked with a machete, which is pretty horrifying for us, but unfortunately it's pretty common down here. A lot of the dogs are looked at as being a nuisance, and people are not very nice to them sometimes. So we probably got in the wrong person's way and they just smacked him with the side of a machete.
This experience has been very eye-opening. I mean, when you look at the quality of care and the level of care that these animals have compared to the ones back home, it's really astonishing.
We never know what we're getting into when we get down here, if the local people are going to be welcoming to us or not. And everybody's been happy to see us at the clinics. We've had to turn people away, which is awful. We can only do what we can do, and there's so many dogs and cats that need help down here. This trip, for so many people, a lot of people have never traveled outside of the U.S. A lot of people have never seen a third world country firsthand. To be in the middle of it and to see it, and to see the local people, to see how people live in different countries, it's such an incredible cultural experience for our staff. It's a great bonding experience. We rent a house, we all live together, we cook together, we're all together the whole time. So the team building, it's awesome.
We basically take two totally different cultures that are just worlds apart. And you know, our staff that's from Maine, and you know, we live in our little Maine bubble, and then we have, you know, all these people down here in Roatan that live in their little Roatan bubble. And truly, it's just a collision of these two cultures. It's hard to describe how powerful of a feeling it is, and such a moment to have gone through this just really hard journey, and just everybody walking away so fulfilled and so happy.